You know, it's wild to think that sometimes the very medicine meant to save us can actually unleash an invisible enemy. Today, we're going to dive into a medical mystery, a case where the cure itself becomes the trigger for a pretty nasty infection.
All right, let's put on our detective hats for a second. Picture this. An older man, he just finished a long course of antibiotics. But then, bam, he develops really severe watery diarrhea, nausea, awful abdominal pain. So, what do you think is the likely cause here? It's a classic clinical puzzle, but the answer, well, it might surprise you. Okay, so what's really going on here? What's the culprit behind this sudden illness? Let's pull back the curtain and identify the organism responsible for this whole mess. And there it is. The diagnosis is Clostridioides difficile, or as you've probably heard it called, C. diff. If you guessed that, seriously, props to you. It's a name that gets thrown around, but how it actually works is, wow, it's pretty fascinating. So what is C. diff really? Well, it's this super tough spore-forming bacteria, but its real trick, it's a total opportunist. Think of it like a villain just waiting in the shadows. It waits for the perfect moment to take over, and that moment, ironically, is created by the very antibiotics we use to get better. Okay, and this is a really important point. We hear a lot about superbugs, right? These multidrug-resistant organisms. But here's the thing. C. diff isn't technically one of them. It's not that the bacteria is resistant to the drugs themselves. No, it's much smarter than that. It thrives in the chaos left behind after the antibiotics have done their job. It's a subtle but absolutely crucial difference.
So that brings us to the big question. How does this hostile takeover even happen? Well, it all comes down to the super delicate ecosystem living inside our gut. And, what happens when that balance gets totally, completely thrown out of whack? Okay, so here's the game plan. Step 1. A patient takes antibiotics for something totally unrelated. But these antibiotics, they're not very picky. They're like a broad-spectrum weapon. So step 2, they wipe out the bad guys, sure. But they also take out all the good, helpful bacteria that keep your gut in check. This creates a massive power vacuum. And that's C. diff's cue. With all its competition gone, it just takes over and starts multiplying like crazy. And once it's built its army, it moves to step 4. It starts releasing these 2 nasty endotoxins that make you sick. And it's these 2 toxins that are the real problem here. They're the ones that directly cause the main symptom of the infection, which is that terrible, watery diarrhea. They basically just attack the lining of your intestine, causing all this inflammation and making you really, really sick. All right, so we get the science behind it, but let's bring it back to the person who's actually sick. What does a C. diff infection actually look and feel like? Well, the symptoms really paint a picture of a body that's, well, it's under attack. We're talking frequent, watery, and, pretty foul-smelling diarrhea. Plus nausea, vomiting, a fever, loss of appetite, and that abdominal discomfort we mentioned. And remember that fast heart rate from our case at the beginning? That's tachycardia. It's a sign the body is under a lot of stress, fighting this thing off. For the longest time, C. diff was pretty much thought of as a hospital problem, something you only had to worry about if you were admitted. But that's just not the case anymore. The whole landscape of this infection has changed a lot. So let's take a look at where it's really popping up now. And this really shows you the shift I'm talking about. Back then, C. diff infections were almost always linked to a stay in a hospital or some other healthcare facility. But now, the infections are actually most prevalent out in the community. It's moved beyond the hospital walls, which means the risk is frankly a lot closer to home for all of us. So what gives? What's driving this huge change? If C. diff isn't just a hospital bug anymore, why are we seeing it so much out in the community? Well, the primary reason is actually pretty straightforward. It all comes back to how we're prescribing antibiotics, but this time in the community. At doctors' offices, urgent care clinics, you name it. That's what's creating the perfect breeding ground for C. diff to thrive outside the hospital. So here's the crucial point, the main takeaway from all this. The rise of C. diff in the community is directly, and I mean directly, linked to how we use antibiotics. This isn't some new super strain that just appeared. This is a direct consequence of our own actions. And that really leaves us with a heavy question to think about, doesn't it? I mean, C. diff's rise is tied to our use of a genuine miracle cure, antibiotics. They've saved countless lives, but it makes you wonder, are we creating our own enemies? Are we so focused on fighting one fire that we're accidentally starting another one right behind us? It's a really delicate balance for sure.